It's a global pandemic. That both creates and adds to poverty.
Wherever there is poverty, wherever there is social exclusion, wherever there is poor access to services, wherever there is silence or discrimination against people who are going to be affected by the disease, that is where the disease is able to take root effectively and to affect millions of individuals.
Its stigma alone can be deadly.
Many of the government-sponsored and other healthcare services in these countries were afraid of people with AIDS. They rejected them. They wouldn't treat them.
In the midst of HIV and AIDS destruction, countless agencies, organizations, and individuals labor to loosen the disease's grip on communities across the world. As an institution, the Catholic Church is one of the largest and arguably one of the most effective organizations in the struggle. It cares for 1 in 4 people living with HIV around the world. Yet much of its work is unknown and often misunderstood. What makes the Catholic Church so uniquely suited to respond to what many consider the public health challenge of our time? This is the first in a series of short films documenting the strengths of the Church's response. We examine how the Church is able to mobilize communities to care for the sick and how it addresses some of the more pressing issues of stigma and discrimination, antiretroviral therapy, orphans and other vulnerable children, and prevention. In this segment, we take a look at the Catholic Church's vast infrastructure and how it is put to work in the struggle to contain the ravages of HIV and AIDS.
The Church reacts to HIV and AIDS in the same way that it reacts to all human emergencies and problems. It wants to be close to the people who are affected directly by these problems. And also the Church responds to these problems out of its mission to be a teacher, to be a servant, and to accompany people spiritually. And that's really the way the Church began its ministry in HIV and AIDS, by first of all informing people about the situation of AIDS, giving basic information, and also helping to reduce all of the fear and the stigma and the ignorance in reaction to people living with HIV.
Through its hospices and hospitals, orphanages and churches, its parish outreach and international agencies, the Catholic Church has been a crucial player in virtually all aspects of the global response to HIV and AIDS. Its presence in cities as well as rural, remote areas around the world puts it at the center of the pandemic.
Almost immediately, people with AIDS, especially in high prevalence countries in Africa, came first to the church healthcare services. Many of the government-sponsored and other healthcare services in these countries were afraid of people with AIDS. They rejected them. They wouldn't treat them. The church opened its doors to provide healthcare and then provided special social services and support both to the people directly living with the virus and to their loved ones and to their survivors.
The Joint United Nations Program on HIV and AIDS reported that in 2007, over 7,000 people were newly infected with HIV each day, with young people aged 15 to 24 accounting for 45% of all new HIV infections. In just a little under 3 decades, the virus has infected 65 million people across the globe and killed more than 25 million. The Catholic Church approaches the challenge holistically, understanding that medical care addresses only one aspect of HIV's effects, so it puts to work its vast array of services, administering antiretroviral therapy, helping families care for their sick at home, providing prevention education, reducing stigma and discrimination, supporting orphans and other vulnerable children, administering the medical care to alleviate the symptoms of the disease, providing food, ensuring children and adults get a decent education, and helping affected families support themselves through employment and small businesses.
The Catholic Church has a presence all over the world and therefore has an ability to touch the lives of so many people, both people who are affected by this disease, people who may be at risk of acquiring the disease, or people who need to know about this disease. I think that the Catholic Church has a tremendous role to play because of that global reach. There are many best practices that the Church has really driven over the past 27 years of this epidemic. Some that come to mind are the incredible grassroots mobilization of communities against HIV/AIDS. Work that the church does on a day-to-day basis of caring for the sick, caring for the dying, ensuring that there's effective access to HIV treatments or promoting HIV testing at the grassroots level in areas where the federal government perhaps cannot reach.
But more than its size and long reach, the church is unique in its ability to give spiritual and emotional support, helping people infected with HIV to live with hope and, when it is time, to die with dignity.
You know, the mission of the church is to bring life, and like Christ himself, to bring life to the fullest. So the suffering of other people is the suffering of the church itself. But yet, we are to preach a message of hope, to reach out to these people, and they see that they are recognized. They are still part and parcel of our community.
The healthcare, pastoral, and educational infrastructures of the church enable it to spearhead some of the best practices in caring for individuals, families, and communities affected by HIV and AIDS around the world. Yet without the help of the very communities affected by the disease, the church could not bring to bear the services needed to care for the sick.
What type of drug do you take in the morning?
I take that red one and the white one, and 8 hours.
In the next segment, we look at the importance of community involvement in caring and advocating for the sick.